Thank you so much again for being here today. My name is Chelsea Wright Hogwart, and I am one of the Deputy Organizing Directors here at Vot ER. And as an organizer, I am beyond passionate about mobilizing health professionals on the ground to uplift their patients' voices. I work to help make sure that professionals have access to the tools and materials that they need to be successful in their nonpartisan civic engagement efforts. Today, Kruti Patel, a health administrator at one of our phenomenal institutional partners, who I am sure that you all are familiar with, Atrium Health, and Yinlu Zhu, Vot ER's head of product, who makes the magic happen behind the scenes for these materials, are going to be using the next segment to provide insight as to how our tools work. Kruti is the Director of Government Relations for Atrium Health and helps coordinate government relations activities for their health system. She also heads the Healthy Democracy for All initiative at Atrium Health, which supports teammates and patients with the democratic process and civic engagement. Yinlu is the head of product here at Vot ER, where she helps to create the materials and tools that you all and we use to integrate voter registration into healthcare settings. She's been a part of the Vot ER team for over 2 years and has spent the past year leading the upgrade of Vot ER tools and tracking efforts. Please give a warm welcome to Kruti and Yinlu.
Hello. Okay, give me 1 minute to share screen. Okay. So, before I get started, I wanted to connect this back to the core focus of this conference. So we just came from a session where we heard from a range of professionals on how health and voting are intricately connected. And what makes this work thrive is when civic engagement is so embedded into our daily practice and environment that it begins to feel like a routine part of the healthcare process. What we know from research is that when this is properly embedded, people are more likely to register to vote. So what we've learned in particular from our work with partners over the past few years is that in an ideal scenario, patients should see and or hear about voter registration 5 times throughout their patient visit. And my goal for you all is that by the end of this, you'll be able to envision what that would look like at your institution. So I will give a brief overview of tools, talk about some best practices that we've learned from working with our partners, and then touch on our new impact tracking feature before I hand it over to Kruti. So I break down Vot ER tools into kind of 3 main buckets. First, Vot ER has our badges, which allow healthcare professionals across all role groups and specialties to help their patients get ready to vote. It's really as simple as giving your patients a QR code or URL on the badge to scan and let them take things from there with our self-service platform. And just this year alone, we've sent out over 30,000 of those badges and lanyards. Vot ER also offers digital and printable materials like posters that hang in waiting rooms and handouts to distribute with discharge paperwork. I'll go over more of that in a minute, but we have over 500 hospitals and clinic sites using these resources. Now, all of our resources, badges, handouts, posters, direct to what we call our landing page, which is essentially just a resource hub for patients, not only to register to vote, but also to learn why and how to vote. And if the concept of our badges is newer to you, here's just a brief overview, what I call anatomy of a Vot ER badge. The very basic function is that the QR code and text code are there on the front of the badge so that patients can easily access our landing page. And we've added 2 new things this year. So if you, on the back of our badges this year, we have something called a Why Vote page. We heard feedback from folks in previous years that patients were frequently asking, why should I vote? And while we recommend that you weave that into your response and weave in your personal why, if you're in a time crunch, the goal is to have a resource that you can point folks to that does some of the voter education for you. Our lanyards that we send with badges are designed to serve as a visual prompt to get patients thinking about voting before you even bring it up. And we made the decision this year to make them bilingual since so many of our partners work with Spanish-speaking patients. So once you've gotten patients to engage, whether that's through them scanning your badge or typing in the URL they see on a poster, there are 3 ways they can actually get to our landing page. They can use the camera on our smartphone to scan the QR code. They can use any cell phone, even if it's an old school Motorola, to text a code to a number and get the URL texted back to them. And they can use any device to visit the web URL. So some folks actually have like computers and iPads set up for patients to do this. Now, when they get to the landing page, it has a couple of components, and some of these might be new to you because we revamped it very recently. One of the questions we frequently get asked from folks is, what if patients have questions about voter registration that I can't answer? The good news is that your interaction with your patients should only involve you inviting them to engage with these tools. Our goal is to incorporate this into your clinic while maintaining respect for your priorities and the job that you signed up for, which means we don't expect you to be experts on voting. We have a partnership with a nonpartisan organization called Vote Writers, whose mission is to be able to answer these questions from voters and provide them with accurate, up-to-date information related to voter registration, election laws, and voting requirements. There's this contact helpline button that folks can push, and it'll prompt them to send a text to a real-life person, a volunteer who's trained to answer any questions someone might have about the voting process. At the bottom of the page, top, there's a similar button that converts tools to Spanish for your patients for whom that's their primary or preferred language. And that why vote section that I talked about 2 slides ago is also on this landing page. It's just a matter of pushing this little prompt to see the rest of the information. So if you're here and you're like, I already knew all of this, but I want to know how to do more, I do want to share some best practices for how to think about making the most out of our resources. It's important to recognize that for some people, they might have never been asked to register to vote before. It's actually more than 60% of eligible voters who have never been asked to register. And we spend a lot of time thinking about how to reach these folks with Ideas 42, wonderful nonprofit that specializes in applying insights from behavioral science. Specifically, there's this idea called the mere exposure effect, which means, in the very, very basic terms, the more someone gets exposed to something, for instance, voter registration, the more comfortable they feel with it and the more they like the idea. This is really important since we all know, as people who are registered to vote, it is not exactly a linear and straightforward process all the time. So when talking with Ideas 42, we realize there are 2 main ways that this mere exposure effect can apply to our work. So we really stress the importance of asking every patient. Even if you don't get someone registered to vote directly in your clinic, just asking that patient has positive impacts on their broader civic journey, because it means the next time they hear about it, even if they're outside your clinic, they'll be even more likely to actually register to vote. We also stress the importance of adding touch points, which is what I'm going to focus on for the rest of this presentation. If someone's seeing a piece of paper at check-in and posters in the waiting area, by the time they get to an actual visit, if their healthcare professional asks them to register to vote, it feels even more natural after seeing so many visual prompts beforehand. I do want to reiterate, our tools are designed to be non-disruptive, optional, nonpartisan. They're not meant to add to plates that are already quite full with multiple crises happening in the moment. But there's a way to respect those principles and still have the multiple touch points that I talked about at the beginning. So a couple of ways to do this. If you're talking about ways to integrate this into your environment, your institution, in waiting areas, we have digital materials like waiting room slides you can put up on TVs, screensavers of iPads. We also have posters that you can print out. We recommend you put those in high traffic areas next to a bathroom, a wall plug at the check-in area. And we also have handouts. So we have flyers with voter registration information that can be given with discharge paperwork at check-in, can be taken home later to share with family. On an individual level, healthcare professionals can add voter registration as a question at the end of their visit. And I'm about to show a video. One of our civic health fellows, Anu Sharma, was very, very kind and gracious to share a video example of what this can look like. And we are going to hope that I don't get technical difficulties here.
Just a friendly reminder that to turn on your sound for your screen share too.
Yeah, I think I have it, but holler if it doesn't work.
So Victoria, I see you're almost 18. Yes. And I see you have your phone with you. I do. That's awesome. What do you think about me registering to vote today? I would love to. You're almost 18, right? Yeah, yeah. So look, I have a badge here. Ooh. It's got a QR code. Okay. So here, you can try if you just bring your You just point your camera to here, and it'll take you to a site called Turbo Vote. Ooh. And it literally takes about 3 minutes. And you will be pre-registered to vote. Ooh, nice. Yeah, I would love to be pre-registered. Yeah, I am really encouraging my older teenage patients to register to vote. Yeah, because you want to vote for for your families, for your community, for the things that you believe in, right? For the future that you want. So I think it's really, really important for younger voters to show up. Yeah. So if you just scroll through the steps, you will get to a point where you need your social security numbers, and at some point you'll get to options where it says register or pre-register for 16 and 17-year-olds. Okay. And that's where you'll. Are you done? I think so. Oh, there we go. Okay, I think I did. Awesome. Thank you, Viva. So that's the QR code. And then on the back, it takes you to a site that talks about why it's important. Okay.
All right. So let's say you do all the things we just talked about. You crush it like Dr. Sharma. You might be wondering, how do I know if any of this is working? We've built out a way for you to get live feedback through our new Track Your Impact page. Before I show what that looks like, I do want to give a quick overview of what makes our tools trackable. So you'll see 2 types of URLs that will be attached to your tools and your QR codes. One type of URL has a numerical code. The other type is a letter code. So numerical codes you'll see with our individual badges that you send out. My badge is number 265. And when I use that, it tracks towards not only my individual impact that I can see, but also towards Vot ER, the organization that I'm affiliated with. It's a really cool new thing we have this year that allows you to build teams, move across institutions, all of that fun stuff. Our letter codes are what we send out for organization-wide materials. For instance, Vote Health is Vot ER's unique code. You can use either of those and look up your impact on our impact dashboard. You can do things like zoom in on certain date ranges, see numbers for people who have started the voter reg process or started the process of requesting a ballot through your tools. All of the nitty-gritty info on how to do this is on our website. I have the URL on the top of that slide, and I'll also send in the chat in a second. And that is it for my spiel. I do always want to end on a note of gratitude. This is incredibly important work, as we heard today, and I'm more than happy to support you and chat through email about how our tools can best suit you, your community, your organization. My email is up there. But now I'll let Kruti take it over for now and talk about how Atrium has used our tools. And Kruti, give me a second to pull up your slides.
Sure, thank you. While you pull those up, Yinlu, my name is Kruti Patel. I work for Atrium Health. We serve 4 states, one of them being a huge swing state. And so all of this just further underscores how important civic engagement is for our teammates and for our patients. I'm the director of government relations. We're a small but mighty team, and this is something that's so passionate to us. So thank you for letting me be here and speak today.
Bear with my terrible PowerPoint sharing skills.
No problem.
Let's see.
Okay.
There we go.
Yes, there we go. You can go ahead to the next slide, Email. Okay, so at Atrium Health, our mission is to improve health, elevate hope, and advance healing for all. In order to advance our mission, we're committed to use our ability to help leverage social and political influence to help strengthen some of our most vulnerable communities. We've been partners with Civic Health Month and Vot ER since 2020. A few of our emergency room doctors saw what was happening at Mass Gen, and they were just inspired. So, the question becomes then, how do we use our mission to do these things? So our team, prior to COVID, used traditional methods of encouraging civic engagement, like in-person voter registration drives and the sharing of important deadlines and dates during election season. We're a small but mighty team, so getting out there and getting to everyone the information to make it visible, it was tough. But in 2020, our docs recognized that many people in the communities we serve didn't have access to a lot of the traditional places where they would typically receive vital information like census information and voting information. The implementation of Vot ER in several places across the country, like I said, inspired many of our physicians, and the Healthy Democracy for All initiative was born. This initiative was the brainchild of one of our leading ER docs and the government relations team at Atrium Health. Next slide, and then one more, sorry. Thank you. So elements of our Healthy Democracy for All initiative include, in 2020, encouraging census participation. We also had a Million Mask initiative where we promised our community in Charlotte that we, along with some other partners, would provide over 1 million masks. This helped to provide a COVID-safe environment for both the Board of Election staff as well as voters when they showed up on election day to vote. We had this huge mask up when you go vote campaign and encouraged early voting as well in COVID-safe ways. So one of the biggest prongs of our Healthy Democracy for All initiative was our partnership with Vot ER. We partnered with Vot ER to help provide access for our teammates and patients to not only register to vote, but get information about all the, ever-changing and confusing ways to even get to election day. How do you register to vote by mail? How do you register to vote? How do you vote by mail on election day? Or how do you vote by mail early? So all of these things, we partnered with Vot ER to help get across to our patients and teammates. Next slide. So in 2020 and beyond, so now for 2 years, we've worked with Vot ER to sort of revamp and amplify our traditional voter registration efforts. We got posters and handouts, both in English and Spanish, and we put them in patient and teammate spaces like our EDs, our waiting rooms, our patient care rooms, break rooms. We did office locations when you walk in, by elevators, so many other places. And we included a text number like the one shown below and a link so that they could type it in on any device and get to a place to help vote, to facilitate voter registration. So closer to elections, we transformed our initiative into a Go Vote and Go Vote Early campaign. We also use lanyards and badge stickers for our providers who are facing patients. We also used a Microsoft Teams background that was inspired by Vot ER and adapted to our needs by our internal communications teams for Microsoft Teams and Zoom meetings. We also use specific text numbers and links for Atrium Health to help our internal communications for emails, internal social media, email signatures, and the like. These communications were all combined to help create talking points that were used for leaderships and teammates. We created a whole document of FAQs and put them on places where leaders and providers could access easily when they got questions from patients or teammates. Next slide, Malia. Thank you. So overall, Vot ER has been such a great partner to work with. We can't thank them enough for how much it's really helped us up our game. We have an organization-specific representative we work with. This rep knows about all the states we serve and the implications that has for civic engagement in the communities that we serve. They worked with us to design what works for us, as each organization has specific needs, and they helped cater to what was good for Atrium Health. They always provide regular check-ins, and they're just an email away. So they're so easy to get in touch with whenever we have questions or issues. So in terms of feedback from our clinicians and patients, everyone loved what we did. We've received countless emails from providers thanking us for making this more accessible for both teammates and for patients. We received so many accolades for making access to information about voting accessible and shareable. It was easy for them to share with their families, their friends. And then, our providers got so jazzed up. They all wanted to pitch in. Like, for example, some of our teammates at one of our behavioral health hospitals, they got so inspired to host a couple of their own voter registration drives. And this helps immensely when, you're a small but mighty team and you have all these people willing to go out on the ground and inspire others to vote. So in 2020, we had upwards of 350 teammates and patients both registered to vote that year through Vot ER and other traditional voter registration drives. Our patients reached out to providers. They stated they appreciated the access to the information, talked about how they loved that it was easy enough to share as well. And, I think that a lot of our patients and providers appreciated that, as Yin Lu talked about, that the information was accessible when they wanted it, but not in their face. So next slide, Yin Lu. So that's it for me. Do y'all have any questions? I'd be happy to answer them.